Hardly a week goes by in my practice without a patient pulling me aside after their appointment, lowering their voice, and asking the question they've been afraid to ask out loud. Dr. Dailey, my mother had Alzheimer's. Am I going to get it too? If that's a question you've asked, or one you've been afraid to ask, I want to talk to you today because the honest answer is more hopeful than you've probably been led to believe. I'm Dr. Mark Dailey. I'm a doctor of chiropractic and a certified functional medicine practitioner. I've been in practice for over 30 years in the state of Alabama. And cognitive health, protecting the brain, is something I think about and talk about with patients every single week. It's personal for me because my grandmother suffered with Alzheimer's disease. She didn't recognize me or any other family members for many years. I understand why this fear is so real when you've watched someone you love, a parent, a grandparent, a spouse, lose themselves to dementia. It doesn't stay abstract. It becomes very, very personal. It becomes something you lie awake thinking about. You notice when you walk into a room and forget why you came. You notice when a name you've known for years just isn't there. And in the back of your mind, you wonder. That concern is not paranoia, it's actually wisdom, because the people who do something about cognitive decline are the ones who start paying attention before a diagnosis forces their hand. Here's what research tells us, and what I tell my patients: family history is a risk factor. It is not a sentence. Genetics load the gun, lifestyle and nutrition pull the trigger. And that means you have far more control over this than you've probably been told. In 30 years of practice, one of the most consistent things I've seen is this: the patients who are struggling most with brain fog, memory loss, and cognitive decline are almost always deficient in the same three nutrients. Not because they're doing anything wrong, but because after 40 years, our bodies absorb and produce these nutrients less efficiently, and most conventional medicine never check. I want to walk you through those three nutrients right now: what they are, why they matter for your brain specifically, and what I personally recommend. Before you run out to Walmart and try to buy these products, know that all supplements are absolutely not created equal. I'll give you my recommendation at the end of the video. Number one is vitamin D, and I say this knowing that most of you have heard you should be taking it. But here's what most people don't know. Vitamin D isn't just a vitamin, it's a hormone. It regulates over 2,000 genes in your body, including genes directly involved in brain inflammation, nerve function, and the production of serotonin and dopamine, which you may recognize as neurotransmitters. Over 70% of adults over 40 are deficient. That's 7 out of 10. That puts you potentially 70% chance that you are deficient. And the standard blood test reference range most labs use are not appropriate. Anything above 20 nanograms per milliliter is called normal, and that's far too low. In functional medicine, we want you to be between 50 and 80. Most of my patients come in well below that. Number two is omega-3 fatty acids, specifically EPA and DHA from high quality fish oil. Your brain is roughly 60% fat, DHA. One of the key omega-3s is the primary structural fat in the brain tissue. It's what neurons are built from. When you're not getting enough of it, brain structure and function suffer. That's not a metaphor. That's physiology. Omega-3s also reduce neuroinflammation, chronic low-grade brain inflammation that has been directly linked to accelerated cognitive decline and Alzheimer's risk. This is one of the most well-researched areas in brain health, and it consistently points in the same direction. People with higher omega-3 levels have better cognitive outcomes as they age. I do want to say this clearly. Not all fish oil is equal. The form matters enormously. Most store-bought fish oil is poorly absorbed. I'll tell you what to look for in the free guide. Number three is one most people haven't heard of, and it may be the most important one for brain health specifically. It's called magnesium, but not just any magnesium. Over 80% of Americans are magnesium deficient. So you got 70% deficient with vitamin D and 80% with magnesium. Magnesium is involved in over 300 different enzymatic reactions in your body, including the ones that regulate stress response, sleep quality, and nerve transmission. But here's the thing most doctors never mention. Standard magnesium supplements don't cross the blood-brain barrier. They help with muscle cramps and digestion, but they don't get into your brain. There is one specific form that does. It's called magnesium L-threonate, and it was developed through research at MIT specifically for this purpose. Studies show it increases synaptic density. That's the connection between brain cells and meaningfully improves both short-term and long-term memory. In my clinic, this is often the supplement patients notice first. Better sleep, less brain fog, sharper recall, usually within the first 2 or 3 weeks. 30 years ago, I couldn't have told you any of this with much confidence. The research on nutrition deficiencies and brain health has exploded, however, in the last decade. We know more now than we ever have, and what we know is genuinely encouraging. You're not powerless here. Family history is a piece of the picture, but so is what you put in your body every day. And three specific correctable deficiencies are among the most significant and the most overlooked contributors to cognitive decline in adults over 40. I've put together a free guide that goes deeper on each of these three nutrients, what they do, what to look for in a quality supplement, and the exact doses I recommend. The link is in the description below, or you can find it at drmarkdailey.com. It's free, no obligation. And if you have questions, if you want to know whether this protocol makes sense for you specifically, you're welcome to call our clinic directly at 205 625 3488. We are a real practice with real people who will take your call. Thank you so much for watching. Take care of the only body God gave you. It's worth protecting.